Hi everyone, my name is Pauline. I'm a Belgian nuclear medicine resident, and this video is an introduction to PET imaging. First, I will tell you the differences between PET, CT, X-ray, and MRI. Then I will tell you how PET scans are used to detect cancer, and finally, I will tell you if radiation from a PET scan is dangerous. PET, CT, X-ray, and MRI are commonly used imaging techniques. CT, X-ray, and MRI belong to radiology, and PET belongs to the field of nuclear medicine. The main difference between those two groups is their focus. CT, X-ray, and MRI create detailed images of organs, bones, and other tissues. A PET scan, on the other hand, shows doctors how the tissues in your body work on a molecular level. CT, X-rays, and MRI are therefore called structural imaging techniques, whereas PET is a functional imaging technique. For example, if you have pain in your ankle and the doctor suspects a fracture, he will order an X-ray or a CT scan. Both imaging techniques are good at diagnosing bone injuries. If it will be most likely a ligament injury, the doctor will order an MRI scan. This is because MRI is better suited for examining soft tissue injuries, particularly in the ligaments or tendons. And finally, if a bone tumor is suspected, a PET scan will be performed. PET uses a radioactive drug called a tracer to look at the function of your organs. The most commonly used PET tracer is a molecule called FDG. FDG is nothing more than a glucose or a sugar molecule with a radioactive part attached to it. In a little under 2 hours, about half of the radioactivity will be gone due to radioactive decay. So the clock is ticking to get the scan done. Because FDG is very similar to glucose, our body uses it like it uses glucose. FDG travels through your body and gathers in cells that are using a lot of energy, such as cancer cells. The radioactive material decays and gives off tiny positively charged particles, which we call positrons. A camera will record the positrons and will turn the recording into pictures on a computer. Cancer cells show up as bright spots on a PET scan because they use more glucose than normal cells. In this way, a PET scan can help to show cancer, find out how big it is, and whether it has spread to other parts of your body. One of the most important features of a PET scan is that it allows physicians to see changes in the tumor before they are visible in other images. Changes in glucose use by a tumor happen before the size changes, and images from traditional CT and X-rays only show the size and the shape of the tumor. So many cancers can be detected using PET before they can be seen using other imaging techniques. Is a PET scan safe? Even though no amount of ionizing radiation is completely safe, the amount of radiation the body received during a PET scan is actually quite low. One scan is comparable to what you're exposed to over 2 or 3 years from natural radioactive sources, or the amount of cosmic radiation a pilot would be exposed to after 25 long-distance flights. In general, a PET scan is considered to be a safe procedure, and the benefits of having a PET scan outweigh the risk of exposure to the small amount of radiation received during the scan. So remember that PET visualizes how well your organs and tissues are functioning, whereas X-ray, CT, or MRI give you anatomical detail of the structures and tissues of your body. Furthermore, PET uses glucose-specific traces, such as FDG, to diagnose cancer. This is because cancerous cells take up more glucose than the rest of our cells. And finally, PET scans do carry a risk of radiation, but the benefits of these tests are usually greater than the risks. Thank you so much for watching this video. If you liked the video, please give it a thumbs up. It would really help me.